Respiratory, this is Tori.
Hi.
Hi, Mrs. Pribble. How are you today?
Good, how are you?
I'm good. Your doctor's ordered some respiratory care treatments for you today, so I'm going to help you. Is that all right?
Yes.
Have you ever done any respiratory care treatments in the past?
No.
Okay, so I'm going to instruct you on how to use those today, okay?
Perfect.
All right, great. Okay, so before we get started, I just need to take a quick listen to your breath sounds, okay?
Okay.
So I'm just going to have you take a nice, I'm going to have you sit up nice and tall, and I'm just going to take a listen, okay? All right. Go ahead and just take some deep breaths for me. Good. All right, and then I'm just going to go ahead and get your vitals here quick before we get started. Go ahead and get your pulse. All right, perfect. Okay, so today it looks like your doctor's ordered for you albuterol, Spiriva, and Symbicort. And these are all medications that are going to help you to breathe better, okay? So we're going to go ahead and start with the albuterol first. And when we take albuterol, we take it through a nebulizer treatment. And so a nebulizer treatment looks just like this.
Okay.
And the easiest way to put in the medication is to just go ahead and put it in right through the top.
Okay.
All right. And then you always just need to make sure that it's plugged into the compressor and it's plugged into the wall.
Okay.
So this albuterol is a bronchodilator, which means it's going to open up your airways and help you breathe.
Okay.
This is going to be taken every 4 hours.
Okay.
So to take this medication, we just turn on the compressor, turn on the electricity, and you're going to see a mist come out. And you're going to wrap your lips tightly around the mouthpiece here, and you're just going to breathe normally. And then every 3 to 5 breaths, you're going to take a nice deep breath in and continue to breathe normally.
Okay.
And you know the treatment's done when it starts to sputter.
Okay.
All right, so we'll go ahead and do that now. All right, great. There you go, that nice deep breath. Perfect. Okay, and then I need you to go ahead and take a deep breath in and cough for me. All right, good. So like I said, that's going to be one we're going to take every 4 hours, and you can take that as needed as well. The next medication that your doctor has prescribed for you is Spiriva, and we take that through a dry powder inhaler, looks like this. This is going to be one that you're going to take 1 time daily, okay? And so to do this, the first thing you need to do is make sure you take a deep breath out as deep as you can, away from the mouthpiece. We'll slide the cover open just like so, and then when you're ready to breathe in, you're going to go ahead and seal your lips tightly around the mouthpiece. Take that nice deep breath in, hold it for about 10 seconds, and then you can exhale. Just make sure that you exhale away from the mouthpiece, because any of that humidity can clump up the medication that's inside. And then also, if you see right here, there's a little dose counter, and that's going to let you know that that's how many doses you have left. Okay, so go ahead and let you take that treatment now. And just slide that mouth cover, then go ahead and take that deep exhale to the side, and then go ahead and wrap your lips tightly and inhale. Good, hold for 10 seconds, and exhale to the side. Great, and then you can just go ahead and recap for me. Perfect, very good. All right, and that's also a bronchodilator, and that lasts just a little bit longer than, that's gonna last a little bit longer than the albuterol.
Okay.
And so that's why we're taking that as well.
Okay.
This is gonna last longer, so you only take it once daily, keeps those airways open.
Okay.
Okay, so go ahead and take a deep breath in and cough for me. All right, very good. And then the last medication that we're going to take today is Symbicort, and that is a corticosteroid, which is going to be used to help reduce any inflammation that you have in the airways.
Okay.
This is something that you're going to take once daily, 2 puffs, and that's in a meter dose inhaler. So that looks like this.
Okay.
The way that you use one of these is that first thing you need to do is make sure you shake it up really well. That's
Okay.
very important. And then if it's been like a while since you've taken it, you want to go ahead and just take the mouthpiece off and discharge 1 dose into the air. That way you know that you're getting the full dose when you take the medication.
Okay.
Okay. So to take this, you're going to shake it first, take a deep breath out, You're gonna wrap your lips around the mouthpiece, and then when you breathe in, you're gonna push the canister at the same time, simultaneously. Hold that breath in for 10 seconds, and then you'll be able to exhale, okay? And then we're gonna wait 30 seconds, and then you can do that same process one more time to get the 2 puffs, okay?
Okay.
All right, so go ahead and do that for me now. Okay, and hold for 10 seconds. Good, go ahead and exhale. All right, yep, shake her up again, perfect, and one more time. Very good. All right, and go ahead and exhale. And I need you one more time to take a deep breath and cough for me. All right, very good. So whenever we take a corticosteroid, we always need to rinse our mouth and spit that out. That's going to prevent any thrush from building up in your mouth. So that's really important as well. Okay, super. All right. So I'm going to go ahead and take another quick listen to your breath sounds, and that's to make sure that these treatments are working the way they're supposed to be, okay? So go ahead and sit up nice and straight for me and take some deep breaths here. We'll go ahead and get the vital signs one last time. Get the pulse here. All right, Ms. Purple, do you have any questions for me today about your therapy?
I don't think so.
Okay, if you ever do, feel free to call in and we can clarify anything that you're unsure about, okay?
Perfect.
All
Thank
right,
you.
here's that call light for you.
Thank you.
All right, and I'll see you in about 4 hours for the albuterol treatment, okay?
Okay,
All right,
thank
thank
you.
you.